am so glad to have Senator Warnock with me today. He has been a really strong champion for lowering drug prices. I also want to welcome Shannon from Georgia, who's going to talk with us about her experience. Kevin from my home state of Washington. Both of them are going to be sharing personal stories about the challenge of affording insulin today, as well as Leslie Dock, who is with Protect Our Care. And I do want to take a brief moment to especially recognize Kevin, who really led the fight in my home state of Washington for us to make important progress at our state level. And I'm really grateful, Kevin, for you joining us today as we fight for federal legislation that will make an even bigger difference for so many people. You know, this is an issue that I have heard about from so many people in my state, like Kevin. And that should be no surprise. There are over 30 million people in our country that have diabetes. That is essentially 1 in 10 Americans. And it is absolutely wrong. Any one of them would be forced to choose between getting groceries or getting a life-saving drug, or between paying rent, paying for their prescription. Yet that is actually the reality that countless patients are confronted with every time they go to get their insulin prescription filled. I have heard from people in my state who have insurance, who've worked their whole life, who've saved their money, but still have to work an extra job or moved in with their family just so they could afford their insulin. And they still walk up to the prescription counter with a pit in their stomach and that dreaded question in the back of their minds, how in the world am I going to be able to pay for this today? They still can't help but wonder, given the exorbitant cost of the drug they need, whether they would be better off rationing insulin, risking their lives just to make ends meet for their family. Years after the price of insulin has been going up, just over the last decade, insulin prices have actually tripled. But it is not like insulin is 3 times better. It's the same product. Drug companies just keep jacking up the price up to reap bigger profits. And the harsh reality is the cost of insulin isn't just out of control. It is devastating families. It's bankrupting them. It's hurting patients. Then this just has to stop, which is exactly why Senator Warnock and I have been pushing for steps to bring down healthcare costs. And we are especially focused on making sure insulin is affordable for everyone who needs it. Democrats have come forward with some bold ideas to bring down costs, including ideas, by the way, to give Medicare new power to negotiate and force drug companies to bring down prices, and ideas like Senator Warnock's proposal to cap patient insulin costs at $35 a month. And we're even looking at whether there's room for bipartisan progress on insulin costs. I'm glad to see Senator Shaheen and Senator Collins are working on that as well. So with all the work that is happening now, all these ideas for progress, and even interest from some Republicans, I am more hopeful than ever that we, and by the way, more determined than ever, that we can find a path forward on steps that bring down the cost of insulin and have a meaningful impact for so many patients and families in the country today. And I know that Senator Warnock and patients like Kevin and Shannon that are with us are really determined to get this done. Why? Because we all understand insulin costs too much. It has cost too much for too long, and too many people depend on this drug for us to let this moment go by. Life-saving drugs do not do any good if you can't afford them. So we've got to fix this. And I am delighted that I'm with Senator Warnock today. He has been a super champion on this, has just been dogged, and I believe he is the guy who's going to get this done for us. So Senator Warnock, thank you for joining me. I'll turn it over to you.
Well, thank you so very much, Senator Murray. It's wonderful to be here with you. You've been in these fights for a long time, and I'm just grateful for your courage and the depth of your commitment to the things that matter. You've been a real champion. I'm also proud to be here with people like Shannon and Kevin, and we look forward to hearing from them. We're all here for one reason, folks. Costs for prescription drugs like insulin have skyrocketed, and it's time for Congress to do something about that, to act, to lower the costs of this life-saving drug and others for the people who need them. If you need insulin, you need insulin. It's not a mere inconvenience if you can't have access to it. This is a life-saving drug. Almost nowhere is the need more clear to lower prescription drugs in general than insulin. More than 37 million Americans have diabetes. That includes over 1 million Georgians. Of these millions of people, many manage their diabetes with insulin. And over the last decade, insulin prices on average have nearly doubled, or in some cases tripled, for many Georgians and Americans. I saw one study from the Healthcare Cost Institute that said that people with diabetes spend close to $6,000 per year just on the insulin. They may need some other things, but just the insulin alone is $6,000 a year. That is a real setback for the hardworking families in my church and ordinary folks that I know. People are paying record prices, while at the same time, pharmaceutical companies are making record profits. Consumers paying record prices, pharmaceutical companies making record profits. In fact, the cost of insulin here in the United States is 10 times more than it is in other high-income countries. So this is a public policy issue. The scientists who discovered the patent for insulin a century ago sold the patent for only $1 because they had a kind of moral bearing that said that they didn't want to make money off of it. So they sold the patent for $1. Insulin was created a century ago. So when we look at this rise in cost, we're not talking about the cost of R&D, research and development. We're paying the cost of greed. And so I've been working for a long time to make healthcare more affordable. It's something I was working on even before I came to the Senate. I've been fighting hard to strengthen access to free and affordable healthcare and to lower prescription drug costs. If you can't afford your medication, then your healthcare isn't affordable. And that's why I introduced the Affordable Insulin Now Act and why it is so important. What will this act do? It will require insurers to cap patient out-of-pocket costs to no more than $35 per month for insulin. This will reduce out-of-pocket costs for many insulin products and provide savings to millions of insulin users. It would be hard for any one of us to find someone who doesn't know someone with diabetes. And as a pastor, I can tell you I've seen up close the devastation that happens when this disease goes untreated. In fact, my office here in the Senate has received about 3,000 letters from Georgians about lowering prescription drug costs, and about 10% of those letters, 300, are focused on lowering the cost of insulin. And that's why I'm so glad our guests are able to join us today, and I'm especially glad that Shannon is here to share her story with you. Please hear these stories, because this is the human face of the public policy we would make. The politics should never be about the politicians, but the people we are here to represent. Passing my Affordable Insulin Now Act will help hundreds of thousands of Georgians like Shannon's son and people across our country. This isn't an ideological issue. It's not a partisan issue. It's a practical one. And I'm glad that we've been able to build a coalition to support this legislation that stretches from the grassroots to the House, to the Senate, and even to the White House. In fact, they're voting in the House today. I keep checking in with my staff to see where they are on the bill. And I hope that they can pass it so that we can do the same thing here in the Senate. Lowering insulin costs is something that has support in red states and blue states. In fact, some 20 states and Washington, D.C. have passed legislation already to cap out-of-pocket costs for insulin. That includes red states like Utah and Oklahoma and Alabama. Democrats and Republicans here in the Senate have worked on this issue in the past, and I believe there should be a bipartisan path to getting something done right now. At the same time, we can't wait to have this conversation. We have to do the work even now. And so I'm pushing my colleagues to broaden our coalition, for Congress to take up my bill and to take action on this issue next month. And I am deeply heartened that Senator Murray is with me in this fight. Shannon's family and millions of Georgians and Americans need affordable insulin now, and Congress needs to act to make it happen. So I'll hand it over now to Leslie from Protect Our Care.
Thank you, Senator Reverend Warnock, and thank you, Senator Murray. I mean, we could not have two more affordable, formidable, and committed senators on this effort than the two of you, and we all owe you a debt of gratitude. You know, we're having this conversation at a time where Americans are particularly worried about the cost of living. They see prices rising all around them, whether it be at the grocery store, at the gas station, and of course, at the pharmacy. And yet, despite all of that pressure, the cost of prescription drugs rises to the top of that list. And that's because the cost of healthcare is especially difficult for people and families, because it truly is a matter of both financial security and pressure and life and death. And we all know what that feeling is like, as the senator said, in the pit of our stomachs, when not only are we worried about surviving, literally surviving, but also about making sure that our families have a square meal and a roof over their head. No one should have to choose between the drugs they need to survive and the putting food on the table or caring for their family. The drug prices are simply skyrocketing out of control. If the price of milk rose at the same price as prescription drugs, a gallon of milk would cost $13 today. And if a gallon of gas would cost more than $12 today. Imagine the furor. Imagine the furor if we all went to the gas station and the cost of gas is $12 a day. And yet that's in comparison what people are feeling about something, you know, they have no ability to work around. There's no public transportation. You can't work from home. This is the real thing. In today's America, the issue is that drug companies get to charge whatever they want, and they get to raise prices every year as high as they want, and they make record-breaking profits, and only the people suffer. As others said, the insulin has been around for more than a century. Insulin that cost about $100 a few years ago is now $300 a vial, and people often are dependent on more than one vial to survive. Senator Warnock's bill capping out-of-pocket insulin costs at $35 a month for people with insurance is a lifesaving, and it will put more money in people's pockets when they need them the most. And as the senator said, the House of Representatives is debating this bill right now on suspension because they knew exactly how important it was to move forward. It requires a 2/3 vote there for that in order to move with alacrity and speed. Let's hope they get it because it's the right thing to do. Now's the time for the Senate to do the same. Democrats are united in this purpose, and Republicans should be as well. And Republicans are taking a hard look at this. They need to take a really hard look at this. Senator Murray and Senator Reverend Warnock have been reaching across the aisle, and it's time that 10 Republicans extend their hand in return. It's not too much to ask. If not, more families will suffer. One final thought is that lowering the price of insulin is critical, but it's not a sufficient response to the problem of rising prescription drug costs. The bill we were talking about today, Senator Warnock's bill, will make a tremendous difference in the lives of millions. But we still allow drug companies to keep the profits they make, even after this bill. And we require the taxpayer to absorb the burden. But this bill is absolutely the right and necessary thing to do. It's just simply not enough. Insulin is just one of many drugs that cost too much. Congress must also give Medicaid the power to negotiate for lower drug prices, stop egregious annual price increases, and cap out-of-pocket costs for seniors. There are some pundits who suggest that acting on this bill, on the insulin bill, will take away from the momentum for a broader solution. I couldn't disagree more. I think it will add to the momentum for a broader solution because it will show the American people that we can get things done in Washington. And it will show just how important the unfinished business is for the American people. So thank you again for inviting Protect Our Care to participate today. Thank you, Senator Warnock and Senator Murray, for all the work you do. But now we get to hear from the people who really matter and who were brave enough to tell their personal stories so that their friends, their families, and others can benefit as well. And with that, let me turn it over to Kevin Wren. Thanks, Kevin.
Thank you, Leslie. And thank you, Senator Murray and Senator Warnock and Protect Our Care for hearing my story and working on this vital issue. I first rationed insulin back in 2009. I graduated into the recession and I had aged out of my parents' insurance. The cost of my insulin was more than the cost of my rent, and I was juggling food, rent, and my insulin, as well as my life. Fortunately, I got full employment and was able to afford my insulin, but then was at risk again back in 2013 after losing my job, and COBRA payments were more than I could afford. My insulin was more than my rent again, and I was at risk of rationing. But fortunately, the Affordable Care Act was rolling out right then, and I was able to afford health insurance and my insulin, and I didn't really have to ration again. But in my work now, I work with Washington Insulin for All to pass legislation like we talked about, copay caps. There's been, I think, over 30 throughout the US in the last few years. Here in Washington, we just lowered it down to $35. And I am still helping people ration who are rationing insulin, crowdsource and source insulin, either support their GoFundMe or to source directly from someone willing to share their supply. And this is really untenable. But the Affordable Insulin Now Act is a great step that will limit the insurance co-payments of insulin to $35 per month. This is in line with the actions that we've taken in Washington State and across the country in GOP-controlled places like Utah and more liberal places like here in Washington. We've seen a bipartisan effort to pass these things. As written, this bill will not help all people with diabetes because it does not tackle the uninsured and the underlying cost of insulin, leaving the most vulnerable of us to face the full brunt of the cost of insulin. But this will help 1 in 4 people afford their insulin here in the US, which is huge, and will definitely make an impact on their livelihoods and lives. This legislation will leave people like me to choose between buying our insulin and paying for our rent or buying food. That is why we are calling for the Senate to incorporate amendments to cap the price of insulin, not just to provide co-payment caps. This is, again, an amazing step and will help so many people, but we do have a long ways to go. Thank you. And I'll pass it over to Shannon.
Thank you for allowing me the opportunity to speak today. My name is Shannon Bjornaby. I am a 19-year Georgia public school teacher. I am the proud mom of 5 boys, 3 who live at home with me, and now all 3 of them have significant medical issues. Our type 1 journey started last summer whenever my children went for their yearly well child checkups and my son went for his senior year sports physical. And his doctor had described him as being and this is quotes, perfect specimen of health. But then we got some results back from some of his testing, and my 17-year-old son, James, was officially diagnosed with type 1 diabetes. This resulted in an unexpected 3-day hospital stay where we learned to manage his care. I learned how to give him his insulin and the ratios and the math. It's a lot. It's an awful lot to have to absorb in a very quick amount of time. As we were leaving the hospital, I vividly remember telling him, honey, you're going to have a good job when you get older, because he has to have insurance now. It's a non-negotiable for him. And that was not his original track in life. In order for us to leave the hospital, I had to purchase all of the things he needed to survive. We had to buy insulin and many other medical things that a diabetic needs. I was very fortunate that I had put the full amount of money into my health savings account the previous year, and I was able to afford the $900 copays to let him come home from the hospital. That is a lot to absorb for a family like mine on a public school teacher's salary. Our summer plans were completely disrupted. We did not go on our annual vacation. The children did not get their new prescription eyeglasses. We all need eyeglasses. We didn't get wisdom teeth out and braces put on, because when it comes to prescription eyeglasses or insulin's going to win out every time. Thankfully, my son is doing a lot better. We have found some programs to help afford his insulin through our insurer. The thing that really bothers me a lot is that we live in the most prosperous country in the world. And I should not have to choose between my comfortable life, that I've done everything our society tells us we need to do to be successful. I'm a college graduate. I own my own home. I have a steady, good paying job, and I'm having to choose things every month in order to make sure that my son gets the care that he needs in order to survive. And I shouldn't have to do that. Thankfully, the ACA has made it to where he can stay on my insurance until he's 26, and that is huge for us. But I'm very much concerned that after that, he's going to have to make some tough decisions. He's a young adult on the cusp of adulthood, and he's going to have to make some changes in his plans for life in order to be able to sustain his insulin cost. Before I hand it over, I just brought a visual today. This is a box of fast-acting insulin pens that a type 1 diabetic has to inject every single time they eat in order to bring down their blood sugar. The cash price for this is $680. I paid $100 for my copay. This is a box of, again, pens. This is the insulin he takes every day, once a day, in order to maintain his blood sugars as much as possible, especially overnight while he is sleeping. And this box of pens cost $470 out of pocket if I had to pay the cash price, $100 again for my copay. Those are just two of the things that he needs. He has to have all of the supplies that go along with that. And I worry that as an adult, if he does not find a job, or that if insulin prices continue to rise, this is not something that he will be able to do. And he will have to do like our friend who spoke before me and ration insulin. And you hear too many horror stories of college students and young adults and older adults that are having to do that. And as Americans, we shouldn't have to choose between the roof over our heads, our children's braces or eyeglasses, food, or insulin to keep a loved one alive. So that's my story, a little bit of it. And I just wanted to share that with you all today. And thank you so much to Senator Warnock and Senator Murray for letting us have the opportunity to share our stories and to lead this charge for us, for all of the many, many, many people who are in this same situation as we are. We appreciate it more than you know. And thank you very much.